At this time, I'm delighted to introduce our next facilitator, who is my colleague, Jan Appleton, who's a senior manager in public health and prevention programs at Interior Health here in Kelowna. And she's also a member of the advisory committee for the Institute for Healthy Living and Chronic Disease Prevention. So would you please join me in welcoming Jan Appleton?
Thanks, Joan. I'm just so excited to be here. And I think this afternoon's plenary is a session you're really going to enjoy. I know I'm very much looking forward to it. We're going to hear about some of the concepts that we've been hearing about in the last 2 days, applied in an illustrated way in the broader context beyond just universities. As Joan said, I work for the local health authority. And less than a year ago, the health authority, Interior Health, the City of Kelowna, and UBC Okanagan signed a Healthy City Partnership a statement of collaboration. This collaboration aims to support evidence-based policy enabling healthy citizens to thrive in sustainable urban environments today and long into the future. Initially, we will have 5 areas of focus: housing needs, greenhouse gas targets, urban food security, urban and cross-boundary transit and transport, healthy city strategy, and age-friendly environments. And did I say that's 5? It's actually 6. With that in mind, I'm very excited to introduce Joet Garcia. Joet is the incumbent mayor of the City of Balanga in the Philippines. Joet and a university president partner have adapted the model of a university town into a health promotion project to improve modifiable life factors with evaluation research integrated throughout the whole project. Outcome data indicate significant improvements to health, economic, and sustainable areas. This city's achievements have been recognized with numerous national awards for its outstanding programs in health, literacy, business promotion, tourism, environmental protection, and public safety. I now present this leader and agent of change, Joet Garcia.
All right. Thank you, Jen. Good afternoon to everyone. In the Filipino language, we greet each other by saying mabuhay or magandang buhay, which means a beautiful life. May I request everyone to say mabuhay to your seatmate? Thank you very much. I would like to thank the UBCO family, especially Claire, for inviting us to this wonderful conference. It's really a great opportunity to learn and to meet other individuals who value health promotion. In this presentation, I will be talking about our city's health promotion activities. But to put things in the proper perspective, I'll first give a brief background on Balanga. Sorry, that's the word mabuhay, and that's how we show our smiles. So we are a small city with an area of 111 square kilometers and a population of less than 100,000. Our GDP per capita income is $1,281, and the 2015 city government budget is only $12.3 million. But our strength lies in the fact that we are the center for education in the province, with the presence of the Bataan Peninsula State University and 8 other colleges with over 18,000 students. And we wanted to capitalize on this positive fact. Thus, our vision is We want to be recognized as a university town by the year 2020 and be the center of excellence and innovation. We want to be the Silicon Valley of the Philippines. But for this to really happen, we need the critical support of our families, being the basic unit of society, and be able to create a learning environment in the whole city. What do I mean by this? We want to replicate the university setting, which is the best for learning, with the proper infrastructure, the right environment, the presence of outstanding educators, and an excellent mix of students. These all have to be present inside and outside the campus, in the four corners of the city. We realize that we have to include the education component if we are to solve problems in the city such as poverty, health, peace, environment, and many others. To attain a vision, we've set 4 goals. First is access to high-quality education by providing scholarships to college students, teachers and professors for their postgraduate degrees, and parents to help them cope with various challenges. Second, by providing the necessary student facilities such as the library, a nature park, the residences, and an activity center like the plaza. Third, create a conducive learning environment by giving students access to technology and information, providing free Wi-Fi, maintaining peace and order, making Balanga clean and green, and most important, effectively promoting health through our Go for Health movement. Actually, this will also help students avoid vices such as smoking, drinking, and drugs, which are a hindrance to their studies. Then finally, ensure job opportunities for our graduates by linking them with the industries and businesses. Prioritizing health promotion for us was not just some motherhood statement, but was born out of a need to solve a problem. Since I became mayor in 2007, the leading causes of mortality in the city are due to non-communicable diseases. I didn't really have to look at these figures because in the Philippines, since we have a very personal and paternalistic relationship with our leaders, as mayor, it is common practice to attend the funeral services of our constituents. And whenever I ask the family on the cause of death, it is always due to NCDs. Sadly, I was also able to observe that our people nowadays pass away at an early age. In fact, our life expectancy in the city is only 62 years old. Not only that, we also have deaths and injuries caused by vehicular accidents due to drunk driving. As in most cities in the Philippines, these are the challenges we face. Fast foods are very accessible. Eating unhealthy foods is cheaper and more available. Lack of physical activity, especially in children who'd rather browse the internet or play computer games. There are also limited resources for health facilities, and of course, the tobacco and liquor industry interference. But guided by the Ottawa Charter, we then made our move to try and reverse this trend by localizing healthy public policies, creating a healthy lifestyle committee, enhancing community participation, encouraging intersectoral collaboration, creating supportive environments, intensifying health education and public information, strengthening our rural health units, training and capacity building, and research, monitoring, and evaluation. Let me highlight some of these. We backed up our Go for Health movement with ordinances and resolutions and executive orders to institutionalize these reforms. Go Sustansya means go for nutrition. Go Sigla is health is exercise or physical activity. Go Slow sa Tagay means drink moderately. And Go Smoke Free is tobacco regulation. As you can see, we've passed the different laws that will help support the implementation of all these programs. We then focus on three important groups to enhance participation. First, the parents. Two, the community, or what we call the barangays. And three, our schools, led by the state university. We have 21,000 households, and our target is to get all parents to graduate from our parenting program. So far, we've had more than 7,000 parent graduates. Why is this important? Because the parents are the first caregivers and teachers of their children. If we help and remind them of their responsibilities, then it's like having thousands of leaders in our communities. The program uses a case study approach, 10 sessions. The modules are localized and touches on every aspect of family life. For example, on health issues, it starts with the proper nutrition, as indicated in modules 3 and 7. EduChild proved to be very effective in improving their children's school performance, as 20.5% received academic honors. No dropouts, completion and graduation rate were 100%. Because of the program's success, the foundation of the country's biggest television network, ABS-CBN, will replicate EduChild in various cities in the Philippines.
The capital city of the province of Bataan, Balanga, has been at the forefront of efforts to prioritize family values among its people, as well as strengthen their financial capacity to rear responsible and loving children through a parenting course. Bantay Bata 163 will soon replicate the same project as an advocacy.
Akala ko tama lang yung nag-asawa ka, nagpalaki ka ng mga anak mo. Hindi pala. Kailangan din palang matutunan natin yung stages kung paano siya mapapaunlad at magiging maayos ang buhay ng mga bata.
And to help
in the community, our strategy was to empower their government officials through a program called Barangay Week. Since our city is composed of only 25 barangays, every other week, city officials like myself and employees spend the whole week in a specific barangay to deliver various services and, more importantly, directly consult and dialogue with citizens on various issues and concerns. We launched the barangay version of the Go for Health that led to a massive healthy lifestyle campaign designed for every sector, from senior citizens, women, the youth, public utility drivers, fishermen, and others. Aside from explaining the ill effects of smoking, we even identified and recognized smoke-free homes by placing seals such as these. Excessive drinkers were invited to attend a symposium on how to control themselves and make better use of their time. We visited every school to explain the "Wag Maging Sad" slogan, which means don't be a smoker, alcoholic, or drug addict, so that you're always healthy and happy. This is some of the posters that we use, that we put in every part of the city. And as an output, the school celebrated the 2015 World No Tobacco Day by making quit smoking posters and writing letters to their loved ones.
Alam niyo po bang masama ang paninigarilyo? Di niyo po ba alam na nababawasan ng 7 minuto ang inyong buhay sa bawat oras na kayo ay naninigarilyo? 200 katao ang namamatay kada araw sanhi ng paninigarilyo. Pwede sa pamamagitan ng kanser sa baga at bibig, marami pang iba. Kaya sana po, tigil niyo na ang paninigarilyo dahil ayaw po namin kayong mawala.
The activity was a great success because hundreds of letters were sent by their children to their parents and grandparents, and majority responded positively. We also appealed for help from our restaurant and bar owners to support the campaign. We had to go as far as stating the obvious by reminding them that if they take care of their customers' health, then they'll have patrons with longer lives. We Filipinos love the eat and drink all-you-can buffets a little too much. The University Town Education Council was established to involve all schools in the attainment of the city vision. The policy-making body composed of school heads, retired educators, and teachers is responsible for aligning the programs of various schools in improving the quality of education and engaging students to participate in city activities such as the annual University Town Summit. This has resulted in the massive support of students towards our Go for Health movement. Student leaders have organized a meeting to discuss smoke-free initiative that led to the launching of the smoke-free campus attended by over 5,000 students. In order to sustain all these campaigns, supportive environments must be in place. This led to the development of the University Town Master Plan and its institutionalization by passing the University Town Ordinance. The rationale behind the plan was to integrate the community with the university, make it seamless and connected. The architects who worked on this master plan recommended the design and structures of spaces be functional and comfortable for people. The environment should be conducive to stimulating activity, creativity, and breakthrough ideas. It also included land use and regulations within the university town. An example here is the regulation requiring nightclubs or beer pubs to relocate 3 kilometers away from the university town area. The redevelopment of the Plaza Mayor, funded by the private sector, provided students with an activity center right at the heart of the city. Other facilities like the Wetland Park for environmental activities and the City Library for reading sessions were patronized and appreciated by the students. We set up sports clubs to encourage people to attend different physical activity programs like hataw or aerobic exercise at the plaza, and the Balanga U-Town Running Club. I have to run together with the other club members to show that I walk the talk. This has also led to various sectors to organize and sponsor their own sports activities in Balanga, like fun runs, marathons, and cycling races. The city government continues to invest in training and capacity building programs, especially for the health office personnel. The Department of Health sponsored leadership and governance program reminded us that poor public health condition is a result of a weak leadership. Being in government, we are directly responsible for the health of our people, thus it calls for immediate action. Our alliances and networks have also strengthened our expertise in implementing health promotion programs. Just last May, it was an honor for me to have been elected as president of the Smoke-Free Cities ASEAN Network Philippine chapter. Our objective, through the best practices of healthy cities, we will be a big brother in helping other cities implement their own health initiatives. Like all programs, it is imperative to have a monitoring and evaluation system in place. Our ordinances are strictly enforced through various teams like the Bike Patrol for the far-flung areas, Bantay Kalikasan, or we call them the Green Ladies. We chose the most charming and lovable ladies to roam around the university town area to apprehend smokers. We observe if the police are the ones apprehending, they usually get into trouble. And we have a 24/7 command center which monitors all incidents through CCTV. And our active community watch group, iPatroller, keep us informed all the time. Here, concerned citizens send pictures of incidents within their community for immediate resolution. As you can see, number one up there is still the public consumption of alcoholic beverages. To improve our smoking cessation program, we even have a mobile clinic that can go anywhere just to help smokers quit. There's a joke in the city that once you enter this van, you won't be able to go out of the van unless you quit smoking. And so far, results have been encouraging. aside from the numerous health awards that have been given to the city, we now have one of the lowest smoking prevalence rates in the country at 14.79%. The Philippines has an average of 26% smoking prevalence. Our mortality rate due to NCDs have also improved, although I doubt this is already a pattern because it will take some time before all our programs take effect. This has made Balangueños healthier and more productive. We now spend less on healthcare costs and are able to spend more for education and livelihood. The influx of visitors have increased our tourist arrivals by 425% from 2010 and caused businesses to grow by over 75% over the same period. This just means that promoting health in your city or university won't lead to a decline in business, but instead even become a growth driver. Lastly, having a healthy lifestyle is an individual's choice. No amount of ordinances or campaigns can convince a person unless he or she fully understands it and chooses to live a healthy life. For it to really work, we have to form the habits to make health part of our lifestyle. That is why we had to think of every way possible to penetrate the minds of our citizens, most especially the youth. When it comes to health, we have to sweat the small stuff. We produced our own musical miniseries entitled Balanga U-Town, patterned after Glee, to catch the minds and hearts of students and instill in them proper values and the importance of living a healthy lifestyle. Performing in the show are our local talents who can easily connect with their fellow students. It gives us a good opportunity to promote in an enjoyable and creative way the city vision, education, and health promotion. I have here a clip for you of our musical.
Ay naglalayon na mabigyan po tayo ng sapat na kaalaman kung paano po natin mapapalaki ng maayos at tama ang ating mga anak.
Alam mo namang bawal manigarilyo sa Balanga, di ba? Nahuli na kita dati. Hindi ka pa natuto.
Combining the authority, resources, and influence of the city and university will definitely create the proper setting for individuals to live a healthy lifestyle. Since most of you here belong to the universities and colleges, I highly encourage you to connect with your local government. They need you, and together you will make a big difference. Again, mabuhay, and thank you very much.
Thank you, Joet. That was amazing. The progress you've made is, I'm just so surprised. It's just amazing. I can't think of the right word, but it's great to hear about. We do have about 5 minutes for question and answers. So does anyone have any questions for Joet?
And so you were asking about how did you come up with the modules for the parent programs? Knowing oneself and time management as the examples. Yeah, but as examples, just parroting back for those who may be joining from the live stream through the mic.
We had help from an NGO to customize and design all these modules. And they went to Balanga and studied the situations of the different of our families, and then based on their assessment, they came up with modules that are needed by our families. So they really did we did our research to make sure that we're able to address the major challenges of our families.
Got 2 more questions so far showing up.
Thank you so much for your presentation. I'm just curious, what does a smoke-free city mean? Like, how is that defined for your community?
Okay, so we're actually following the FCTC, so the framework convention for tobacco control. And when we say smoke-free city, there's no smoking in all public places. So that includes the sidewalks. I mean, you can't walk in the sidewalk with your cigarettes. You know, and it also means that you can put designated smoking areas, but you have to abide by the requirements, such as it has to be 10 meters away from the entrance and exit of your establishment. Then you can only sell cigarettes in places, 100 meters away from schools, hospitals, and other public places. So we're following FCTC in implementing our smoke-free regulation.
Hi, I'm Michelle Kam with the City of Kelowna, and I'm working with Interior Health on the Healthy City Partnership. And I just had a question for you about for the built environment. Do you have any policy that you've implemented that would help your built environment for your town?
Sorry, the built.
So your built environment, vehicles in Kelowna it causes the most amount of greenhouse gas emissions. So we're working on having more multimodal pathways and more bike lanes and more walkability within our city. But we're still looking at other policies to help, as we create up our built environment.
We're trying to do the same things that you're doing by promoting, again, walking, bicycle lanes. We also required the most common public utility vehicle in Balanga is what you call the tricycle. It's a 3-wheeler public utility vehicle, and most of their engines are the old 2-stroke engines, which produce more harmful emissions. So by end of this June, 3,000 of them will have to comply with upgrading to a 4-stroke engine. We were trying to go for the electric tricycles, but at this point, it's still impractical, especially for the tricycle operators.
Thank you so much, Joet. I have a question about you entering politics in Balanga. Where on earth did you start is the first question. And the second question is, what is the primary challenge you've faced in trying to build a healthy city?
I entered politics in 2007, mainly because my family is in politics. So my father was a member of the legislature in 1987, starting in 1987, and his work inspired me to follow his footsteps. Then in terms of major accomplishment, we began with first strengthening our rural health units, providing basic health services, and then we implemented first among the Go for Health movement pillars. We first implemented the Go Smoke Free. So we started with a smoke free campaign. Then at first it was a challenge, but since there are more non-smoker than smokers, we were able to get the support of our constituents. Then now people were going to the city and asking us to help also regulate excessive drinking. And then, of course, we combined it with positive aspects of health promotion, which is exercise and nutrition.